Today, I'm really excited to be joined by my friend and colleague, Dr. Ian Billinghurst from Down Under. What do you guys call it? Oz in Australia? Is that...
Well, yeah, I guess some people do.
I don't know.
This is Straya, Straya. We live in Australia.
Oh, Australia. Okay. All right. See, I'm learning something new already.
Straya. This is Straya.
Straya. Okay.
Straya.
All right. So we'll leave out a couple syllables. That works. All right. Yeah. So now we're getting an education.
I'm very happy with Australia.
Okay. So anyway, so I had reached out to you a while back, wanting to understand, because we have a lot of followers overseas and a lot of followers in Australia. And so I wanted to get a little bit better understanding about tick problems in particular in Australia, because every time we post something about not using the isoxazolines and some of the really horrible chemicals for flea and tick prevention treatment, because they don't really prevent, whatever. So I reached out to you because people would say, well, the natural stuff doesn't work for me. And what about tick paralysis in Australia? It's a bigger problem. And I mean, really, the what I see in kind of all of medicine, both human and veterinary, is that people do things out of fear. So they're really afraid that their pet might have a tick paralysis problem, or they're really afraid that they might get Lyme disease or anaplasma or ehrlichia. And that fear drives them immediately for the big gun chemicals. So first of all, how big a tick problem do you have over there? Is it in pockets? Is it the whole country? Is it certain areas?
Mainly on the east coast of Australia, warm, humid regions in summer and spring, summer, and to some degree autumn, but it can occur any time of year. How big is a problem is it? If you live on the east coast and you live in a bushy area, it can be an absolutely enormous problem. I was working at an emergency clinic once, and this was something we saw all night. Dogs coming in with tick paralysis, and it's a terrible disease, or it's a terrible situation.
Is it treatable?
It's treatable.
Is it treatable?
And the earlier you get onto it, the better. If it's in an advanced stage, you almost certainly will kill the pet. It takes a lot of effort to and a lot of drugs and a lot of skill and a lot of patience and a lot of hospitalisation to get the animal through it. I think treatment is getting better, but and having said that, I haven't been now in practice itself for 10 years, but and in addition, I haven't practiced on the east coast of Australia for even longer than that. But and back then it was terrible, but things are improving. But still, it is something you definitely have to be absolutely concerned about, and be concerned about how to go about preventing it, and looking for the signs. And if you do find those signs, then get that dog to or cat. I have never treated a cat with this, by the way. It does happen, of course, but so let me say it happens to cats too. But get that animal to a vet immediately. You don't wait till the morning, and you get that dog or cat to the vet. If it's if it's late at night, a 24/7 emergency vet, or whatever you can do to get to a vet. And also, you're going to remove any ticks that you find.
Right. So, is this a bacterial disease? Is it a neurotoxin? Like, how does the paralysis occur?
Well, it's a neurotoxin. It's basically, if you think of it as the tick wants to engorge itself with the animal's blood, and of course it has to enter the bloodstream, and it's part of the saliva of the tick, but you might as well say getting into the bloodstream and getting access to that blood. And a paralysis tick can start off as, well, a match head and end up the size of your thumbnail in a matter of 24, 48, 36 hours. And
So
in
is
that
this a
period,
specific
the
species of
paralysis
tick?
is occurring.
Is it a specific species of tick?
It's a species called Ixodes holocyclus, and it's carried by our native animals, bandicoots and so on. But bandicoots in particular, but any native animal carries it, and of course they are immune to it. In fact, dogs, if they survive, or some dogs just naturally survive, and these are the ones, of course, that are used to produce the anti-tick serum.
Oh,
But
okay. So it's treated with a
it's
serum
yes,
that
it's
is made
yes,
from the immune animals.
yes, and that
Okay,
is
but
improving.
there's no vaccine for it.
No, no, because it is just a
Interesting.
straight. It's a entry of a toxin from the tick as it gorges itself on the blood of the animal. So no, there's no vaccine. Um, of course, there are plenty of topical applications to hopefully prevent the tick from, or make the tick drop off. But even those are not fully effective. And the most effective thing, well, there's several things you've got to do. Number one, keep the dog away. Or let's go back a step. It's the adult female that gorges herself, and she's getting ready to lay eggs and so on. But she sits on a piece of grass or a bit of shrub, and she's waiting for somebody, some person, some dog, some animal to come by. And she jumps on. So it's normally found up the front of the animal, normally, but of course it can be found anywhere on the animal. As they brush through the scrub or the long grass, the tick hops on board. And so it's normally found up the front, but anywhere. And I'll go through searching in a moment. But so the tick hops on board, and over the next few days engorges. And the dog will gradually show signs of paralysis. So the first thing to do in summer, mow all your lawns. In fact, they say it is advised to get rid of things like compost heaps, or don't let the dogs into that area. Wherever there's something kind of tall and full of vegetation, then the dog is likely to carry a tick from there. So that's very important. So mow your lawns. If you're out and about, don't let your dog wander off into the bush. Keep your dog on a lead. Keep it only on short grass. That's number one. Number two, search your dog every day, particularly if they've been out. But search every day anyway, even if it's been out 2 days ago, because there could have been a little tick jumped on board a few days ago, and now it's there working away. And number three, know the signs of paralysis. Now, it's what's called an ascending paralysis. So it starts at the rear end and gradually, say, the hind legs go first. And then you might start to, as it comes forward, you start to get breathing difficulties. So you get respiratory problems. You get paralysis of the throat. So one of the most important things, if you suspect or you have any symptoms that likely to relate to this, do not feed your dog, because with throat paralysis, of course, whatever you give, liquids or solids, can actually enter the lungs, and then you've got a pneumonia going on, which is also very hard to treat. So that's very important. So you may hear changes in voice. That's very common. Difficulty breathing, regurgitation, lots of salivation, coughing, retching, generally unwell, run a fever.
Now, does the tick have to be attached for a certain number of hours in order for that organism or toxin to get into the bloodstream? Is this something that can happen in the first few hours, or do they have to be on there for 24 to 48 hours?
It's happening immediately, and it's gradually and increasing. So you gradually see more, the symptoms get worse and worse. And that's why as soon as you suspect, you must go over the dog to get rid of that tick. And this is very important. So the tick will be found anywhere. So you search all around, all under the eyelids, both sides of the ears, inside the ears, anywhere where there's a skin flap, search that, under the armpits. Yeah. Very methodically go over feeling. Now, sometimes the tick will have fallen off because that's what they do. Once they've engorged, they actually fall off.
Right.
So you're looking for lumps and bumps that are kind of crater-like where they've been, because they form a crater. So you search every orifice and crevice in your dog looking for them. Now, when you get to the vets, they will do the same anyway. The other thing is to remain calm. Don't get the dog excited by your upsetness. Remain calm, and just do it calmly and methodically, and then remove. Now, when you remove the tick, you don't squeeze the tick. There is a thing called a tick remover. It's kind of like a little fork. So it just deals with the head and pulls them off. You probably know that in America anyway, but don't squeeze the body, because you're going to squeeze more toxin, or possibly squeeze more toxin into it. But even don't let that deter you too much. Get the damn thing out, but try and try.
Are people affected by this?
Yes,
does this tick paralysis? Yes. It can be people too. Wow.
Of course, it's a size thing. A big human being, 70, 80, 90, 100 kilos, it's a dose-dependent situation. So one small tick in relation to that is a small dose. If it's a miniature chihuahua, otherwise known as a chihuahua, I like saying chihuahua. If it's a chihuahua, then of course the dose is enormous, and it can be quickly fatal.
Wow, that is so. You guys have the weirdest animal.
We got black snakes and brown snakes and
you've got snakes that are bigger than we have copperheads here, but you have snakes bigger than things I want to think about. So all kinds of weird spiders and
who have been known to live in the roof and come down and attack small children. So yes, we're
okay. Well, North Carolina sounded better all the time. I'll take my cockroaches. Thanks. Okay. So, all right. So this is a pretty nasty thing. How prevalent is it? I mean, is it something, if you're in veterinary practice or an emergency practice, are you going to see these every day, every week, every month?
You can see them every day, particularly in emergency practice, definitely. Wow. I'm thinking of the North Shore of Sydney, where I was part of doing emergency practice at one stage. We saw them every day. We had cases in hospital on drips with anti-venom. A great source of revenue for the makers of the tick anti-venom. And sometimes it was hard to get. Because, there's only so many dogs that are actually have this ability to produce the serum and so on. That was back then. Right now, as a vet who's been out of practice, I can't tell you just how. I assume that it's improved. But again,
I would think somebody has got to be working on producing that commercially.
Oh, I'm sure they are.
So basically, if a dog, I'll have to look that up. If a dog, cat, person, whatever, comes in with symptoms, I mean, obviously it's going to depend on how advanced the symptoms are, but it's basically giving them the antivenom and then supportive care, which would be IV fluids, IV feeding, turning them, just supportive care that you would have to do for a down animal. How long can it take for them to recover? Yeah. How long can it take for them to recover? Can some recover quickly?
A young, healthy dog, yes. An older, less healthy dog, no. It could be weeks, even months. And if they've had pneumonia, again, that can be a problem that persists for some time. If there's actually solid material got down there.
Okay, so clearly a big problem. So I understand the fear base and why the people in Australia, every time we talk about natural flea and tick prevention, they're kind of freaked out. What about paralysis ticks? So I get it. So what is? I mean, you're a holistically minded veterinarian. What did you have your clients use? I mean, so for me, I don't walk my dogs in high grass. I don't take my dogs in the woods. I don't take my dogs in areas where there's a lot of, leaf debris and litter, on the paths and that sort of thing. So, my dog, I never pull ticks off my dogs. And we live on a farm, but they're in open area with a mowed lawn. So I never have to worry about ticks with my dogs, and I don't take them in places. But if I do, like if we're camping and we're in a wooded area or whatever, I use my essential oil sprays, and I've had really, really good success. But I get tick paralysis is a lot scarier. That, I mean, some people get really scared by Lyme disease, Anaplasma, Ehrlichia, Rocky Mountain spotted fever, but they all respond to antibiotics. It's just a matter of knowing that you have an issue and getting it treated. So what do you recommend in Australia for people with dogs that are in those high tick areas?
Okay. Well, once again, I've been out of practice for a while, but when I was in practice, there were several things, and it depended a bit on what the owner was happy to do. The most important thing was examine every day. That was most important. And in most cases, that was the most important thing that could be done. Simply checking your dog. If there's a tick, remove it. And quite often there'd be, at this early stage, virtually no symptoms.
Right.
And we then said, well, but get them to a vet anyway. It's where people ignore the situation that it's a real problem, and they think, oh, well, I don't know whether it's a tick or not, or I've pulled it off, and then don't go to a vet and just let it be monitored or don't monitor the dog. But
Right.
What about the topical applications? And there was also a tablet. The tablet now which you could take, the dog could take, but the owner took it. It didn't do a great deal for preventing ticks in the dog. There was a tablet the dog could take. There was spot-ons, and there was prevention. And people always wanted something. I've never had reported to me, because this happened in the early days. We saw that the cases. In fact, okay, to answer your question, I didn't see that many cases in general practice, and I was in Australia.
Okay.
And we used one of the regular spot-ons we used at the time, and I believe they're still used. They're not 100% effective. The dog can still, the tick doesn't just drop off or doesn't not attach because these are happening.
Right.
That's why I say it's important to go over the dog every day. But the other thing is this: how many dogs get issues with the drugs? I don't know. I never saw it in any dog. I never had reported to me. I would have clients sort of back then who used these, and there were no issues. So I have to report that. That's the way it was. When I was working in the bush, which is the latter part of my career, and for most of it, I guess, yes, but it would have been most of it, everybody who went to the coast wanted some sort of protection, and they had the same thing. They had the tablet or the spot-on. And I got them to use it fairly minimally, because they would talk to me about that. Again, I never had reported a problem. But I remember several of them still came back and said they had their dog in a hospital in Sydney. One or two came back and had tick paralysis in the bush because they'd been to the coast for a holiday.
Yeah, and that's part of the problem, that those things do not repel the ticks. So they have to latch on and bite in order to get the chemical.
That's right.
So that is the
really
problem.
That's why it's always important to go over the dog and not rely on the chemical. But as I said, I never saw a problem with the chemical itself. But again, that doesn't mean it didn't happen. I just never, it was never reported to me. And I guess I wasn't keen enough to go anti-drug to the point where I would look up all the statistics and say this is terrible. For me, it was,
if we go back 10 years, if we go back 10 years, that is when a lot of the oral products first came out, because my first book, From Needles to Natural, came out in 2014. Yep. And those drugs, a lot of the orals, were released in the spring of 2014. And I actually held the book back because I wanted to get information about those products in the book. And here we are 10 years later, and people have been using the drugs. And I actually just received statistics from the FDA as of 2021 with numbers of reported deaths and number of adverse reactions reported for each one of the isoxazoline drugs. The numbers are staggering.
Oh,
And I've also recently heard that the EMA, the European equivalent of the FDA, is actually going to ban the drugs because of the problems. So,
wow. That's terrible to
yeah,
hear. That's really bad. Um,
yeah,
one
chemical
of the earliest
pesticides
things,
are not a solution, really.
no, one of the earliest things I noticed about dogs on a raw diet, if we just ectoparasites in general, they didn't attract them. Now, I can't say that about ticks, but
Yeah.
for example, fleas, so common. Fleas would attack dogs that ate processed pet food, but they just didn't. And I personally have never used any of these products with our dogs, never. And I've never had to
Yeah.
treat tick
Yeah.
paralysis like you in my own dogs, I guess because I'm kind of aware of it too. But I really think that raw-fed dogs are so much more resistant to the effects of these things.
Oh, I agree.
It's just so that's so simple. So, it's kind of hard to comment on a lot of that because I guess a lot of people who attended me as a vet, their dogs were raw-fed, and
Right.
we just ectoparasites were just not a huge problem. They were a problem, seemingly more so in processed pet food fed animals. And I'm probably the worst vet to ask about all this stuff because I didn't use it. I didn't sell a lot of it. I did sell some of it, and I said, look, you're going to have to go somewhere else because I don't carry a lot of that stuff. I do carry some.
There you go. See, well, I was the same way. I didn't carry any of that in my practice. And, we always turned to the natural because what I have found with using topical essential oils, herbal products like neem, the ticks and the fleas really don't like the taste. They don't like the smell. Like they pretty much back it off. It does a much better job of repelling than the oral chemicals where the tick has to latch on. So, so this is really interesting with the tick paralysis because, and if people are running to these chemicals because of that fear that my dog's going to get tick paralysis, your dog can still get tick paralysis. And we found that when we had only the spot-ons, it was before the oral stuff, when Lyme disease first started being talked about here in the late 1990s. All of a sudden, Lyme disease was a big deal. And we did have a lot of dogs that were dying of kidney failure secondary to Lyme disease, so Lyme nephritis. And then we started this whole test and treatment regimen, which is still in place now. We're here in the States, dogs get tested for Lyme disease at least once a year, every year, Ehrlichia anaplasma. It's just part of their heartworm testing. And once we started with that, we see so much less. But what I found to be really interesting, clients who were putting the spot on religiously every month, and I knew they were because they were coming in and buying it religiously every month, we still had dogs with Lyme disease. And it's the same thing as the paralysis ticks. They latch on, they bite. Yes, they're going to die eventually because they're getting that chemical, but it may not be fast enough to prevent the spread of that disease. So really, really interesting. Well, I learned a lot from this conversation, and I appreciate your willingness to talk about it because you guys have some really interesting differences down there.
Well, look,
I don't think I'd ever want to practice in Australia. I don't know. I may come visit someday, but yeah, I may come visit someday. But you're gonna have to tell me how to avoid the snakes and the spiders and weird things.
Well, when you go and collect the eggs, you're always looking out for something curly and round because they don't seem to worry the chooks. We call them chooks or the chickens too much, but they do seem to worry humans if they bite them. And of course, they're attracted to the rats who are attracted to the chicken feed or chook feed. So,
right.
Yeah, backyard.
It's the circle of life.
It is.
Thank you very much, Ian. You are always a breath of fresh air, and we have such a time difference here that one of us is up late and the other one's up early, and I appreciate you being willing to talk to me before you've even had your morning coffee.
It's probably something because I stayed up late watching Netflix, I suspect. Anyway.
That's okay.
It's been nice chatting. It's always lovely to see you.
Well, thank you very much, and we'll connect again soon.
Okay.
Go enjoy the rest of your day.
You too. What's left of it.
All right.
Have a wine.
Bye.
Bye.